I'm Liban Gabra Mikael. I'm the CEO of Taibu Community Health Center. The Black Mental Health Week started in 2019. It was a partnership with the City of Toronto. They were doing a campaign on different issues called the Toronto for All campaign, and they were looking at issues around disability, racism, and they wanted an engagement or a campaign around anti-Black racism and mental health in the Black community. So we convened a community group to look at what the campaign or the message should be. But while doing that, we also engaged the City of Toronto to let them know that mental health in the Black community is a serious issue. And it cannot be just a 1 month campaign during February where you just have some posters on buses and bus stops and stuff like that. So we really wanted to engage them and say this is very serious. It cannot be just a one-off thing. We want this an ongoing conversation in the Black community. And that's how the Black Mental Health Day was proclaimed by the mayor in 2019. And then COVID hit in 2020. And realized that this was even more now serious problem within the Black community, and so it was extended to have the whole week proclaimed as the Black Mental Health Week. Now, the idea of having a day or a week that is specifically focused on Black mental health is to get all of us to talk about this difficult issue that we are experiencing, to have conversation among ourselves, to share programs and services that happens throughout the city, and also to engage healthcare services, healthcare providers to understand how Black mental health or how anti-Black racism is impacting the mental health of Black communities and what they can do. So it's an awareness raising, but also conversation among ourselves, and also a way of engaging service providers to say this is serious. There are some challenges within the Black community and we have a lot of work to do. So we're using this time to have these conversations within ourselves, but also with other stakeholders.
My name is Solomon Lome. I am the project coordinator for Amandla Oluwazi, which means the power of knowledge at Taibu Community Health Center. We launched a new Black mental health website, blackwellnessnetwork.ca. And this website is basically launched as part of the Amandla Oluwazi project. The main reason behind the development and launch of this website is to have resources around the mental health of Black Canadians, which will be accessed by people across Canada, Black folks across Canada. In addition to this, we have partners whom we work with. Generally, we call them Mental Health of Black Canadian Fund, which is funded by the Public Health Agency of Canada. And I think we have over 20 projects across the country. And because with this project, we are gathering knowledge, we are synthesizing knowledge, we are mobilizing knowledge. So generally speaking, this website will be a hub, a resource hub for Black folks who would like to have up-to-date information, tools and resources around the mental health of Black Canadians. And I would say it is an excellent resource for our Black folks who would like to access mental health related information and tools.
My name is Raquel Hamlet, and I am the manager of Wellness and Community Crisis at Taibu Community Health Center. So at Taibu Community Health Center, specifically the programs under my umbrella, the Toronto Community Crisis Service. So it's new to us. We started in April of 2022, and it's a pilot program until 2025. So we're serving the Scarborough area demographic is 16 and over. So essentially anybody dealing with a mental health crisis within the Scarborough community that's just needing some extra support, needing some advocacy. So whether it's a wellness check or somebody that needs to be taken to hospital, threats of suicide, anything mental health related, our team is going out and actually offering mobile crisis services, which is new because it is more of a community support. So trying to move away from police responding to mental health crisis, instead we're now using community workers. So it's a really, really awesome initiative that's been going since 2022, and it's incredible in terms of now we're expanding. So we should be more than a pilot program by 2026. So continuing to offer those services to the Scarborough community as best as we can. We had a one-year evaluation done. So evaluation is done through CAMH, and through that evaluation, the community spoke highly about how much more comfortable they felt having community members respond to them. So having people come to their door that look like them, having people come to their door that, just really understand what it is they're going through. Our workers don't wear uniforms. We're not branded by police, by anything that, a badge or anything like that. We are just wearing our regular community clothes. It may say Toronto Community Crisis Service. It may say Taibu on it. And they're very welcoming to have us in their home, and they talk about the difference that it makes, and having people take the time to listen to them, to hear their stories, and to really advocate for them. So it's been a great response from the community. So if you or anybody that you know, somebody that you love, is dealing with any level of mental health issues, please contact us at Taibu. Also, if you're needing support in terms of needing a mobile crisis team to come out and assist, dial 211. So no longer 911, but 211. You can get the community assistance that you need.
My name is Dana Williams. I'm the new CNS, or Clinical Nurse Specialist, for the IS Circle of Care here at Taibu. So at the Black Mental Health Conference, you're going to expect a whole new sense of enlightenment as it pertains to Black mental health, as well as being able to understand what it means to rest. I've been in mental health for quite a while. I can say since 2009, and I've went to many different mental health conferences. This conference last year was so different. You were able to understand how to engage with clients with Black mental health issues, and how the providers or the people who are servicing them, how they can reach them through different modalities. And it was such an enlightening experience that I then, as a participant last year, decided that this year I was going to be on the planning committee. So I'm currently part of the planning committee for the second annual Black Mental Health Conference through Taibu.
Why is Taibu leading the charge around mental health for Black communities? It's because it is one of the underlying risk factors for our health and well-being. Racism, anti-Black racism is there, but anti-Black racism is manifested in different ways. And mental health is one of the significant areas where we find a lot of barriers and challenges are happening. It starts in school with students, Black students, either not supported or diagnosed with the mental health challenges that they're facing, or misdiagnosed and then leading to more problems, whether it's school disciplinary measures and expulsions and suspension, school dropout rates. We find that the underlying factor is stress and mental health of youth and their parents managing the system and navigating the system. You look at relationship with criminal justice system. That's also another area where most of the Black youth are also experiencing. We know that Black communities in general, but particularly Black youth, are accessing mental services through the criminal justice system. The criminal justice system gets involved first, and that's where they're getting to mental health services. Whereas for other non-racialized population, they go to their primary care provider and then they're referred to a service, right? So for us, it's a different navigation we have to go through. So it's one of the underlying factors of where we are seeing disproportionality and inequities for Black communities. Just like, poverty is one, mental health is one. So if we really are able to really touch upon and focus on this one foundational challenge, then it will help us to address the other challenges that we have. So that's one. Two, we also know that despite the fact that this is a significant challenge that Black communities are facing, there are no culturally appropriate services where people can be referred to or they can access. If they are available, they are not in close proximity to where our communities are residing. So transportation could be an issue, that's another barrier. And so we are also trying to develop culturally appropriate services so people can access those services. And so by doing this Mental Health Week, people are aware of who's doing what in different neighborhoods. And so that also helps them to access the services. And this is particularly very important post-COVID, because a lot of people talk about COVID and the impact of COVID. But for Black communities, there was COVID, and then there was George Floyd, Regis Korchinski-Paquette, all those kind of things that happened. We were double impacted by what has happened in the last 3-4 years. And seniors' mental health, because they were, we worked very hard to get seniors out of their home, and then suddenly we told them, no, go back and isolate yourself. People were not able to grieve and their losses in the traditional way they were doing during COVID. All this is now has become an issue. So mental health is very significant, is the foundation, one of the foundational issues and barriers that we need to address. And through that, then we're able to then address the other issues that sometimes are just the symptoms of the problem. The problem is really rooted in how we are impacted on our mental health and how we are not able to access services that is not available for us.